Good morning, good afternoon, good evening, distinguished ladies and gentlemen, wherever you are joining us from today. Welcome to the 2022 World Bank and IMF Annual Meetings edition of the Global Parliamentary Forum, themed Innovative Solutions for Turbulent Times. My name is Edith Chibuno, and I am the Manager for External and Corporate Relations here at the World Bank, in charge of the Eastern and Southern Africa region. I will also be the moderator of this event today. Before we dive in, just a quick reminder that this session is offered with simultaneous interpretation in Arabic, French, and Spanish. One of our panelists today will be presenting in French, so please do remember to click the translation icon at the bottom of your Zoom screen and select your preferred language. Please do so now. For those of you who may not know, the Global Parliamentary Forum is co-organized by the World Bank Group, the IMF, and the Parliamentary Network. And it engages parliamentarians from around the world in a dialogue on development and matters related to the global economy, with discussions between members of parliament, experts from the World Bank, the IMF, and of course other key stakeholders. Our session this morning is titled Investing in People, Transforming Communities, Human Capital Results in Africa, keeping in line with our overall theme on sharing innovative solutions in times of crises. So just a spoiler alert, we have some really creative and innovative interventions to share with you today. And we hope by the end of this session, our core audience of parliamentarians and partners that have joined us will be inspired with the knowledge shared by our panelists on programs that prioritize people first to boost human capital outcomes and build a more sustainable, inclusive, and resilient future. So without further ado, let's jump right into our discussions. I'm excited to hear from the panelists that have joined us today. So very first, a warm welcome to Honorable Marlene Forte, a member of the Jamaican Parliament and also the Minister of Legal and Constitutional Affairs in Jamaica. Honorable Marlene Forte, have I said your name correctly?
We can take it as you have said it.
Okay. Welcome.
Thank you
For joining us today. Ms. Forte is also the Vice Chair of our Parliamentary Network, our host today. So over to you, Madame, for your opening remarks. Thank you.
Thank you, Edith. Thank you so much. Good morning, good afternoon, good evening to our distinguished audience. My name is Marlene Malahoo Forte, and as Edith indicated, I currently serve as Vice President of the Board of the Parliamentary Network. I serve for Latin America and the Caribbean. I'm overjoyed to be able to join my colleagues from Africa, even though I suspect the audience is much wider. As you know, the Parliamentary Network on the World Bank and the IMF provides a platform for parliamentarians from over 140 countries to advocate for increased accountability and transparency in international financial institutions and multilateral development financing. Since 2000, the network engages legislators to address development and macroeconomic challenges, among other topics. And these are addressed not only in their home countries, but also abroad. The network is an independent, non-governmental organization with a secretariat in Paris, a very supporting secretariat, and it is directed by a board elected by peers. Want to tell you that membership is free and it is open to all elected parliamentarians who hold a current mandate. So if you are in the audience and you have not yet joined up formally, I'm encouraging you to do so. It's important to note that members represent themselves and their constituents, not their countries, not their parliaments or their government. So it provides a wider latitude for engagement. The network's mission is to provide a platform for parliamentarians around the globe to advocate for increased accountability and transparency in international financial institutions, and multilateral development financing. And we know that very little gets done without this kind of assistance. And today, the network is working to strengthen the understanding of the work of the World Bank Group and the IMF among parliamentarians. The network also provides a channel for parliamentarians to inform the World Bank Group and the IMF of legislative priorities on behalf of their constituents. It is also ensuring that the voice of parliamentarians is heard on the subjects in which the World Bank Group and the IMF have a key role. More importantly, too, the network conduct research and share information among members on topics which are of international concern and interest. And really, it builds capacity of members of parliament. I just want to say a little bit about parliamentarians in the field program. So prior to COVID, the parliamentarians in the field program took place in person in a given country. Since 2001, the field visit program has given MPs unique access to the World Bank and IMF country offices, its development programs and key development partners, including, of course, the host country's parliament. During visits, delegates are briefed by the World Bank and IMF country reps on their in-country activities. Visiting members of parliament also meet with host country parliamentarians to discuss the country's development priorities. Participants visit programs and projects while engaging local staff. Delegates also have the opportunity to meet with other key development stakeholders, including NGOs, civil society organizations, and small business owners. At the conclusion of a visit, the delegation shares its observations and recommendations on the host country's development program in a comprehensive report. And just to say, for donor country parliamentarians, the program represents an opportunity to see development cooperation in practice. Borrowing country MPs can use field visits as benchmarking exercises and opportunities to exchange views and experiences. Parliamentarians in the field is jointly organized by the Parliamentary Network, the World Bank, and the IMF. Interestingly, during COVID, when travel was suspended, we had to think of a new method to show development work in practice. World Bank local offices started recording projects in countries and creating these virtual field visits. It is a great opportunity to follow the work of the World Bank on the ground and to engage with local stakeholders. While we sincerely hope that the next field visit will be in person, and I do hope to participate myself, this virtual field visit program remains an important element in sharing information about ongoing projects and hearing the views of stakeholders and beneficiaries. I close by thanking you for joining us for this event, and I certainly look forward to the discussions. So on this note, let me hand it back over to you, Edith.
Thank you so much, Madame, for your kind words and explanation of some of the things that you've been involved in. Indeed, virtual visits are a strong engagement tool that ensures development, work, and oversight continue even in times of crisis. So thank you again for the work that you do. I'm going to call now on Alberto Rodriguez, who is the Director of Strategy and Operations here at the World Bank's Human Development Unit. Alberto is representing our Vice President for Human Development, Mamta Muti, and he is going to walk us through why it is so important to protect and preserve human capital and what key role parliamentarians can play in achieving meaningful outcomes. Over to you, Alberto.
Thank you very much, Edith. It's a great pleasure to be here, and it's a great pleasure to have the opportunity to share with you some of our views around human capital and the importance. I don't think I need to repeat it. I think you all as parliamentarians know very well that people are at the center of our work, that we do our work probably you as parliamentarians and us as World Bank, because we want a better life for people. We want to improve the life, the opportunities, and overall happiness of people around the world, satisfaction with their lives, and a strong contribution to better the lives of others as well. We see human capital from a life cycle perspective. Since a child is born, it consists of providing adequate nutrition, early stimulation and access to learning, the provision of knowledge, skills training, and focusing on health and well-being. And that enables people to realize their potential and be productive members of society. This translates in each of our countries in investing in people through access to healthcare, through quality education, lifelong learning, and skills development through their life cycle. And that helps end extreme poverty and make societies much more inclusive. In this regard, the whole human capital agenda is a multi-sectoral and whole of government agenda. For example, in considering a school, we know that nutrition is essential to keep children nourished so that they can learn. Similarly, we know that having water and sanitation programs in schools are critical to combat illnesses and to bring children to schools. For all of these reasons, the World Bank created the Human Capital Project. The Human Capital Project brings together countries that are particularly engaged with this agenda, that have this as a very high priority. And right now, we have 85 countries of all levels that are part of the Human Capital Project. Many other countries actually do projects in human capital, but are not part of this network, a network that is worth being part of. And of these 85 countries, 32 are from Sub-Saharan Africa. So it is really a fantastic opportunity to exchange knowledge, experiences, etc. We do have an Africa Human Capital Plan. This plan has goals established for 2023, and these goals have been affected by the multiple crises that we have suffered, from COVID-19 to the food crisis and to the natural disasters that are generated by climate change. All of these crises that overlap have generated difficulties in meeting goals and have pushed back some of the achievements that we had obtained over the last few years. Let me talk specifically, for example, of the COVID-19 pandemic that unleashed a terrible crisis and pushed millions of people back into poverty. Beyond the tragedy of the 6.5 million people dead, there's also a tragedy that has to do with the loss of access to critical health services, and in many cases, the learning problems that were there before have been exacerbated as a result of the closures of schools for many, many months. There's also been substantial destruction of jobs, especially for women. The data suggests that the impact of the pandemic on human capital is being felt across all demographic groups, and this has long-term consequences. To make matters worse, the COVID-19 has evolved from a pandemic of disease to a pandemic of inequality. It threatens to push many more people into poverty, and hitting particularly the vulnerable with enormous ramifications on their future and on the opportunities that they may face. I'd like to focus also on the importance of health protection for the poor families. One of the effects of this pandemic and now of the food crisis has been the inability of families to actually reach food, to actually go out and purchase some of the basic needs. Social protection has played a tremendous role in transferring resources to help families who had lost jobs, who could not go out to work because of the pandemic closures, and that have faced very difficult times as a result of this pandemic. Human capital, unfortunately, is something that builds on each year by year. And I say unfortunately because the losses that we have suffered in the pandemic are going to be very difficult to recover. This will entail governments to work together. It will entail governments to prioritize investments in health, in education, in social protection, and in every sector that has effects over the human lives. These investments are urgent, and they require the attention not only of parliamentarians, governments, but of the whole population as an instrument to succeed in the recovery from the pandemic and from the overlapping crises. We will be seeing today in our visits a number of projects that have been particularly successful at dealing with this crisis and with the impacts of them. For example, the Madagascar Improving Nutrition Outcomes, which began before the crisis, has reached important potential effects and benefits for the country in terms of the nutrition of children, but also it has been important in contracting health workers so that there is actually access in every corner of the country to the health services. It has provided enormous opportunities in terms of the skills to service providers and have provided a minimum package for reproductive and maternal child health and nutrition to nearly more than 2 million children and over 650,000 pregnant women. We will also be seeing the Kenya Education Project, which focuses on online access to primary and secondary school to facilitate the smooth transition in the return to school for targeted vulnerable children. The project has financed about 4,900 interactive online lessons for all grades. That's another visit that you will be seeing during the virtual visits. Your role as public leaders is now more critical than ever to advance the agenda of human capital. You're drivers of change, and you play an important part in targeting funding, tailoring programs to the most vulnerable and marginalized peoples in our countries. And you pave the way to a robust recovery in this overlapping crisis. You can count on the World Bank to provide the support, the technical assistance to better address the challenges that are emerging in these times and the urgent needs that need to be tackled. We need to upscale our support for those of the human capital accumulation and to protect people from shocks to ensure that there's maximum utilization of the benefits of strong human capital, the benefits of opportunities, growth, and equity for our countries. Count with us. We hope to continue working with you in this agenda that is more urgent than ever. Thank you very much, and back to you, Edith.
Thank you so much, Alberto. Listening to you talk about the exacerbation of challenges on the human capital agenda is quite striking and of course of a lot of concern. But I also like the examples you've provided of some of the possibilities that can be realized through the result stories that you mentioned. I think that surely leaves us with some hope. We will provide the link to the result stories that will be featured here today, all of which can be replicated in the countries that are represented. Before we move on, I just want to remind folks that we have quite a few people joining us from around the world, and we want to make sure that we hear from our audience and have them engage using the technology that we have available to us. So please use the hashtag #InvestInPeople, as well as hashtag putting people first to share your thoughts with us. We'll be finding ways to bring that into the conversation today. So let's keep it going. Let's keep this conversation going. And the next thing I'd like to do is take a deep dive now into one of those projects in what we are calling a virtual field visit to the Kenya Youth Employment and Opportunities Project. We will speak with the project implementers on the other side, but first let's please see the video. I think we are waiting for the video to play just momentarily. Here we go.
Your Excellencies, Honorable Members of Parliament, ladies and gentlemen, thank you again for joining us. I am honored to offer you a first look at a unique experience that immerses you into the real lives of people in Kenya, Madagascar, and Rwanda, from anywhere in the world. This virtual visit allows participants to see the development context firsthand, to hear from local officials, stakeholders, and beneficiaries, and to feel the positive effects of our collective efforts to boost human capital outcomes. At a time when physical field visits are still complicated, we're excited to provide this opportunity for stakeholders and partners to experience the impact of projects on the lives and livelihoods of people on the ground. Let's dive in. After an introduction video, you'll be greeted with a few basic instructions. Click and drag your mouse to explore the space and click a point of interest to access it. The site itself is separated into 4 projects across 3 countries. In Kenya, learning continuity and basic education, as well as the youth employment and opportunities. In Madagascar, improving nutrition outcomes. And finally in Rwanda, COVID-19 emergency response through vaccines. Let's look at the Kenya Youth Employment and Opportunities Project, or KYOP project. Once inside, you will really feel the environment. Click on hotspots to delve even deeper by watching the personal story of project beneficiaries through the Spotlight story, hearing from stakeholders and beneficiaries, including civil society representatives, parliamentarians, and national government officials, reading more about the project's impact in numbers and seeing images from the project. Let's listen to Esther's story, a beneficiary of the Aspiring KYOP program.
Mimi nilizaliwa katika kijiji kidogo cha Baraka. Katika ile familia hatukuwa na uwezo sana sababu katuaga nikiwa bado ni mdogo. Mamangu alikuwa mtu wa bidii sana. Kila wakati alikuwa anatuhimiza tufanye bidii. Hata japo tunapitia changamoto, lakini tufanye bidii katika maisha na tutafanikiwa.
Nikakuwa nasikia hukumu, nikajihimiza hivyo hivyo kufanya ile kazi kwa sababu watoto wangu wasome. Namsaidia kukala nikipata kinamba na namsukumane na mbereta kala kana kile kitu cha kukala gule.
Hali ilikuwa ngumu, lakini kwa nimekosa matumaini kwamba mimi nilikuwa nimechoka kufanya kazi pale pande ya miti. Sababu masaa ni mengi alafu malipo ni kidogo.
Uko madukani tukaanza kumwambia huyo mtoto wangu. Ikuwa na jihimiza, nasema mimi mwenyewe hata sikusoma. Nenda ukasome, angalie matokeo.
There is a segment of youth that were left out of employment. Youth who are vulnerable through this program of internship and training. We are able to integrate them into our system, provide them with life skills. It has put them at par with other youth.
Mimi niliposema nataka welding walishangaa sana. Ilikuwa ni changamoto kubwa sana. Watu hawakuwa wanaamini kuwa mwanamke anaweza jitolea kufanya hiyo kazi ya mwanaume.
Simea zinenda za kwenda ala nikaona bani hendeze ni musuku umeli akalanda mbola pala munayo. Ile aenda hiyo kazi ile anisedi. Kila mtu asikira chenda re wadima watengeza re kadima mamba ni kazi ya alume kama ya dimansi yema kivirichi.
Watu wengi walikuwa wana doubt. Mwalimu wangu pia alikuwa anasema endelea kufanya utafanikiwa. Nenda ukaanzishe workshop yako.
This program is so important. You are trained to be a professional. If you earn a living, maybe you will teach another person how to earn a living, and that person teaches another person how to earn a living. That's why I like KEO. We encourage each other, we move forward.
Sikufikiria kwamba naweza. Ilitoka ndani ya moyo wangu na nikatia bidii kudhihirisha kwamba hiyo wanawake wanaweza fanya hiyo zaidi. Ni mradi wenye unakuza vipaji vya watu.
I think it's really important for youth who want to join the program to see this as a stepping stone. They're not only able to access jobs, but transform the lives of their family members as well as their community. In the Kenyan context, we say haba na haba, small creates a bigger domino effect.
People have trust me with their work, so I'm generating income from welding. I'm proud to be a woman doing welding.
That's such a powerful story from a strong young woman. We will share the link to the site with you after this meeting, so you can watch Esther's story again and hear from others who have been given the possibility to aspire for more. We also encourage you to share this site with your networks and send us your feedback on what was useful and how we could do to continue delivering compelling results stories. We could not accomplish these successful programs without partners such as yourselves. We hope this site and today's meeting will inspire you to continue engaging and take action to deliver results in Africa and beyond, so that together we can eliminate poverty and inequalities around the world. Thank you for connecting.
Thank you so much. That was truly inspiring, especially hearing Esther's story and her breaking barriers. There's no such thing as a man's work. I love that message in all of this. And also for underscoring how important talent development is to really realizing the opportunities that will translate into jobs. So let me welcome now to this discussion from Nairobi, Peter Mutini, the Deputy National Project Coordinator and Technical Head for the Kenya Youth Employment and Opportunities Project. Mr. Mutini is the Deputy Director in the Ministry of ICT, Innovation and Youth Affairs in Kenya. Welcome, Mr. Mutini. Also joining us from Nairobi is the World Bank team lead for this Kenya Youth Project, and we also saw him in the video, Kevin Perania. Welcome, Kevin. Let's hand over to you now, Mr. Mutini, to offer your opening remarks.
Thank you, Edith, for that introduction and giving us the opportunity to share what we have done for the youth of Kenya. We can say the Kenya Youth Employment and Opportunities Project has impacted positively to the youth of Kenya, especially those who are vulnerable. And we have also given an opportunity to those who are beyond the Form 4 level of our education, that is the graduates who are also given grants to start businesses, and we have had cottage industries where they have created employment for themselves and created opportunities for their fellow youth. So the KO project has impacted Kenyans, and as we talk today, it is a talk all over the country that we spread the project to the rest of the country so that the youth are given an opportunity and it can change their life from being vulnerable to people who are not seeking employment, but are also creators of employment. So we keep on encouraging members to borrow a leaf from what we have done in Kenya, because it is a landmark project that the whole world should borrow from and replicate the same to their countries. And it changes both those youth who have not finished their levels of formal education, and it also gives them an opportunity to impact others and give them an opportunity. So this is a story we are saying. It is something that is giving an opportunity to all, and we are getting enormous numbers that want to benefit from this project. Thank you.
Thank you so much, Peter. So having watched this video of Esther's story, I found it really empowering, and it must be the case when many of the other recipients or beneficiaries of this project are engaged. So I'm wondering if you get the same sense when you're engaged with young people who've been through the program, especially now with unemployment in Kenya on the increase. Do you feel that the project is reaching its intended goals and really providing value for money?
That is very true. It is providing value for money, because even out of the small stipends we give these youth, they are able to save and even start small businesses and impact others. So we can say the project has really created an impact, and there is value for money. And that is why even in our discussions, we always tell our parliamentarians that we need to replicate the project to the rest of the parts of the country, and also other African countries and the world can borrow from us.
Thank you so much, Peter. Let me bring Kevin in. Kevin, as the task team leader for the project, can you give us a little bit of insights into the project cycle, some of the opportunities you took advantage of, but also some of the challenges you might have encountered?
Thank you very much, Edith. And again, thank you very much for the esteemed participants. I think this partnership between the bank and the government of Kenya has really been good, particularly seeing that KIOP is a program that is comprehensive. It brings both labor supply, labor demand, and intermediation to make sure that there's a bundle of really impactful activities that are targeting the youth. And of course, as Mr. Mudini mentioned, this project has really looked at targeting vulnerable youth, youth with no education or very little education, but also looking at youth who would bring impact to the project. As you would have seen in the video, we had about over 300 youth, but also seeing the uniqueness of the employment sector in Kenya. 80% of these jobs in the informal sector. And therefore, the partnerships with different employer organizations, as well as the informal sector master craftsmen, was really impactful, particularly because this brought on board the fact that we were able to make sure that the project is also working with the informal sector to make an impact. I think particularly the biggest challenge is bringing in the private sector, and because the private sector plays a very important role in terms of making sure that jobs are produced, as well as jobs are good, particularly in terms of creating earning opportunities. And of course, this project worked very closely with the private sector just to make sure that there is labor demand, as well as there is a job matching to make sure that the training that the youth were going through was relevant for the market. And I think the fact that sometimes we have challenges in different countries, the project was very particular in bringing in innovative approaches so that we could target different we could target different types of youth with high capacity, those who've mostly gone through higher education, and they were provided with bigger grants so that they can come up with different innovative ideas and employ other youth. But also on looking at other vulnerable youth who could come in with who could benefit from smaller grants, but also socio-emotional skills and business development services, and they could also create their own small businesses and employ youth. And we saw different results coming through. We were able to do tracer studies, and this showed really good results. Particularly, we saw that 93% of the youth who participated in this project were able to get employment or self-employ themselves. And of course, the skilling happened in all economic sectors of the country. So this project has really been impactful, particularly in making sure that different segments of youth, particularly vulnerable, are able to be brought into the fold and reduce inequality. Back to you, Edith.
Thank you, Kevin. You mentioned the private sector and how important they are to this project, to the success of this project. I'm curious about other stakeholders involved in the project. Do you have examples of how perhaps government officials and parliamentarians have contributed to the success to date of this project?
So we have really good partnerships, particularly with the parliamentarians, given that this project has always been oversighted by the Parliament of Kenya. And they've ensured that financing is able to flow to ensure that the project is implemented in the different regions of the country. And particularly, again, providing different sorts of support in terms of bringing in other stakeholders like the private sector, looking at policy issues and seeing how best they can support the different stakeholders to be able to contribute towards unemployment in Kenya. And of course, the project has been able to help bring all these stakeholders together so that they can ensure that there is an environment where jobs are being created, but also the different pieces are coming together. And of course, the government of Kenya has been very, very particular, and I must say that the different officials of government have been very particular in terms of monitoring and ensuring that whatever challenges that came through in project implementation, bringing together all the different stakeholders and trying to find out what the challenges were so that they can come up with solutions, I think was really impactful and was contributed to the success of the project.
Thank you so much, Kevin. Peter, I'd like to bring you in. I know that our audience is listening quite keenly, maybe many wanting to replicate this program in their countries. Can you perhaps share with the audience what you think some of the lessons learned from QIOP are, and what could our audience listening learn from this program, especially as they're thinking about replicating this?
Thank you very much, Edith. I would want them to learn that it is important to equip youth who have limited levels of education with the soft skills. And in this case, we took them through life skills where they will learn about behavior and know how to present themselves, appear in public, and even present themselves, whether in self-employment or employed. And secondly, we would also train them on core business skills, which guides them on how to keep records, start businesses, and even how to quote for businesses whenever there is competition, prepare all that, those documentation. And thirdly, we have also learned that even the low youth who without any level of education, they can still be trained informally through their apprenticeship model. And we have found some of them doing so well, and that has inculcated up in them. Fourthly, I would also want to say that the small grants, giving people even small grants, it has a very big turnaround effect. The ones we have given those grants of as little as $400 US, it has really helped them set up businesses which have succeeded because we have monitored them. And lastly, we do not leave out the ones who have also gone to school well, the graduates and even the postgraduates. We also gave them an opportunity to come up with a business plan competition where those whose ideas were selected, we gave them grants, and those grants, we have seen the ripple effects of what they are capable of doing. So we've told them, don't be job seekers, but be job creators. And that is what everyone wants to create. And this is also something that we also learned from the Nigerian model of the UWIN project, where they were implementing that part of the component. So this is something that we need to develop, and we have worked in synergy because we have had 4 implementing agencies in this project. And as where I sit from the coordinating perspective, we have worked together to synergize in serving the youth and making them create employment for themselves and other youth. Thank you.
Thank you, Peter. And I'm glad you mentioned that this project was in fact inspired by another in a different country. So I'd like to bring Kevin in. Anything you want to add, and what do you want to say about lessons learned here being applied universally beyond borders?
I think one thing that we've noted, and there's a lot of cross-pollination again between different countries. As you've heard, the KIOP project, particularly the business plan competition, learned from the Nigerian UWIN model. But also we have seen the KIOP project also showcased in other countries like Uganda, where they're starting to prepare projects that will have a youth employment component, which I think is really important, because these different lessons from different countries really help bring out solutions that the different countries are facing similar challenges. And I think as we continue implementing such projects, as we continue co-designing with governments these projects, I think it's really important to learn across and bring these solutions to the fore, given that the challenges that youth face are multifaceted, and they need to bring in different stakeholders together to be able to provide credible solutions. Thank you.
Thank you so much to both of you, Peter and Kevin, for your insights. We will share the links to these virtual field visits on the website, and I really encourage everyone listening to immerse themselves in the experience. You'll learn a lot. So thank you both. As our previous panelists said, stakeholders are critical partners in interventions such as the Kenya Youth Project, as they have vested interest in the success of the intervention. Before we start our next panel on stakeholders' perspectives, I'd like to remind you that you can pose your questions to our panelists in the Q&A box in Zoom. Now let me introduce Honorable Neema Lugangira, a member of Parliament in Tanzania representing NGOs. She is chair of the Tanzania chapter of the Parliamentary Network on the World Bank and IMF, which she took the lead in launching just 2 weeks ago. She is also chair of the Parliamentary Caucus on Food Safety, a member of the Committee on HIV, TB, and Drugs, as well as a member of the Committee on Social Services and Community Development. The list of her roles goes on and on. She's done a lot of things, and it's fair to say she is a committed public servant. So welcome to you, Madam.
Thank you very much. I hope everybody is well and I'm audible.
Also with us today is Ms. Purity Nzuki, founder and general manager, Emergency Medical Trainers Kenya, an organization that specializes in medical training solutions. EMT is a private sector partner with the Kenya Youth Project. Welcome to you both. I don't see Purity connected just yet. Oh, she's in the room in Nairobi. There you are. I will start with Honorable Lugangira. Please tell us of your experience, how parliamentarians can contribute to the success of World Bank projects.
Thank you very much. And it's a great honor and pleasure to be here. And Edith, you're a huge inspiration. So I'm pretty excited and starstruck right now being on the same panel with you all. So as you said, we very recently launched the Tanzanian PN chapter. And what I can say is that naturally, there is a huge gap between parliaments and World Bank and IMF. This is in most countries. I believe it's not unique just to Tanzania, but it's in many African countries as per the setting, because oftentimes World Bank and IMF deal.
We have lost the connection. Let's see if we can get her back in a minute or two. But perhaps in the meantime, okay, I'm sure she'll reconnect. So in the meantime, I'm going to bring in Ms. Nzuki so that you can tell us a little bit of your experience with KEOP. I'm so excited to hear from you, Purity. Please go ahead.
Oh, thank you very much, Edith, and it's my pleasure to be here in this forum. I'm here representing emergency medical trainers. Our institution is one of the implementers of the Kenya Youth Empowerment Program. We started with KEOP in the year 2019, and this far we've trained a total of 491 students sponsored by the KEOP projects. And I would say that with the course that we have been offering under the KEOP sponsorship, we've been giving emergency medical responder course to the youth. And this is a very important course in our country because previously we've not had that group of people in the healthcare industry. And we exist to bridge the gap between when an emergency happens and the time it gets to the hospital. So with the 491 youth that we've been able to train, so far we've got great and a lot of success stories that we have from our students, because we are actually bridging the gap literally. We have students that are cutting across all parts of the country, and especially in counties where they are geographically big and there's less access to the medical facility. So our students have graduated and they have gone out there and they are saving lives. And if you go to any government facility today in our country, you will find our students are the ones that are manning the accident and emergency departments, a gap that we are trying to fill now through the projects of KEOP. Previously, you'd find nurses attending to people who have been brought to the hospital, injured, and people who have medical emergencies, people who have cardiac arrest. And this is one area that you may need to know that people who go to medical school, they don't learn how to perform CPR or to attend to somebody who has had a cardiac arrest. So these are the skills that we're giving to our students, and it's been a life changer in our country, because right now we are saying that no life should be lost because there's been a delay or lack of immediate emergency care at the site of the emergency, where the emergency has happened. Road traffic accidents have been a big concern across the world, and this is a gap that we are filling, so that in the event that an accident happens, the people that we have trained are out there in the field and they're attending to medical emergencies promptly and professionally. And this is not something that they're doing just because it's a voluntary work, because we are getting NGOs engaging our students, we are getting the private sector employing the students that have graduated under the KEOP program and that we have trained, and getting employed. So we've got a high rate of employment of the students that we've employed, especially because this was a unique course that we offered in our country that came to fill up the gap. So I would say that the project has been successful from where we sit, because the youth that we have trained so far, they are all engaged in various places.
Thank you so
very
much. Thank you, Ms.
Yes.
Nzuki. Thank you. I'm going to come back to you in a moment, because the collaboration that you talk about between public and private sector is extremely important. But I want to go back to Honorable Lugangira to give you a chance to finish. We unfortunately, technology didn't cooperate with us. Over to you.
Thank you. It's quite interesting that it seems the connectivity is better in Tanzania than DC. So very quickly, I was saying that usually there is a gap between understanding of what the World Bank and IMF does and parliamentarians, and this is natural because World Bank and IMF primarily work with Ministry of Finance and rarely engage with parliamentarians. So even in the efforts towards initiating the launch of the parliamentary network in Tanzania, there was a lot of interest from parliamentarians because we always ask ourselves questions. What is the World Bank and IMF actually? How are they working? How are the projects being overseen, etc. But on the other hand, the people, whenever they hear a government has taken a loan from the IMF or the World Bank or any other international finance service, you know, there's a lot of skepticism because also the people, the citizens don't understand how is this money being used and how is it benefiting them. Meanwhile, we as parliamentarians are representatives of the people. So we have that unique opportunity of being the voice of the World Bank IMF projects and showing the pure value and how the citizens are benefiting. So that's the first gap. And then the other gap is in the sense that whenever these projects are being designed, it's being solely done with governments. And rarely does it include parliamentarians who are representing the people. So at times we may be able to provide guidance. Maybe instead of packaging this project this way, maybe you can look at it this way. Maybe you have picked to prioritize XYZ regions, but actually in those regions, that's not the problem. The problem is in a different region. I'll give a quick example. In Tanzania, we have a very high stunting rate. But when you look at the percentage, if you look at the percentage, the regions with the highest percentage of stunted children, you will go to the regions of the Southern Highlands. But if you now look at the actual number, as per the population size of the regions, it shifts. Suddenly you're in the lake zone regions. I come from Kagera, it's bordering Rwanda, Burundi, and Uganda, and it's the region that hosts the highest actual number of stunted children. But you will not find any development partner initiative in Kagera because all of them are all squeezed into one area because they're going with percentage. But had we been involved as parliamentarians in discussions when they're doing the planning, we would be able to advise and also put our voice in. So the PN chapter brings that opportunity. It cuts through the bureaucracy. We were able to have, for the first time, have a meeting between the members of the PN Tanzania chapter, the global chair, Honorable Liam, and members from the development partners, British High Commission, US Embassy, World Bank, IMF. Rarely, that would never happen. So that's the uniqueness of the PN. But the other uniqueness is, I as a parliamentarian, sometimes I want to knock at a door at the World Bank or UNDP. You don't know how to start. You don't know how to get to those offices, even though you're a parliamentarian. But usually it's like, oh, no, we only deal with government. No. So it's like, then you're kind of stuck. But you're seeing that maybe there's a project, maybe you have an opinion. So there's always these kind of roadblocks, which I feel that the PN truly, it creates that opportunity for us to have a closer engagement and also for us to be well informed so that we can have the oversight role of our governments, but also oversight role over World Bank and IMF, whatever they're doing in our respective countries. So again, I'm so grateful that we got the opportunity to do that. And very quickly, the key thing that I want to also share is I agree with everything that has been said, but there are key areas that I think have been missed out. And maybe this gives us an opportunity when we're reviewing the African Human Capital Plan, the IDA, to bring forward. So very quickly, I'll just share it very quickly. The first one is when we're talking about food security, food crisis, we need to also look at the nutrition insecurity. A lot of African countries, they don't provide school meals, school nutrition, but rarely are there programs that support school nutrition. So we need to take a consideration to that. We're going into the digital era. Lots of our schools in Africa are not connected. There is no school connectivity. Can we have projects? If we're talking about human capital, it means we need to equip our children to be able to go with the 21st century and the digitalization, so school connectivity. Finally is the issue of strengthening health systems. If we want to strengthen health systems, we need to look at the digital ecosystem of the health systems. But at the moment, all of these international financing mechanisms, there is yet a way that clearly defines digital health systems and the issues of data governance, data protection. So these are things that we all need to, I just wanted to touch on that we need to look into, but finally to capacitate us as parliamentarians to keep up with the pace, because things are developing and the capacity building for us as parliamentarians isn't going according to the pace of how things are developing. So if we are to be the ones who can guide, who can oversee our governments or what the developing partners are doing, we also need capacity building to keep up with all of those things. Thank you very much, Edith.
Thank you so much, Honorable Lugangira. And how pleased am I that you have just launched the Tanzania chapter of the Parliamentary Network in your country, because with all of the things that you've laid out, I have no doubt we'll be seeing increased success in Tanzania with your involvement and the involvement of your colleagues. So thank you so much for sharing those thoughts, as well as some of the recommendations that you've laid out for the human capital agenda. So I'm just going to go back to Mrs. Zuki, just for a final word from you. I'd like to just hear from you in a quick line or two. Where do you want to see KOP go next?
In line with what I do, I would like to see KOP expanding the wings across Kenya so that we can, for us as implementers of the project, so that we can be able to cover the whole country in terms of creating more capacity for people who are equipped in saving lives, because we say no life should be lost out of lack of immediate medical care. And we have counties in this country that are far from help, and it hurts us when we go out there and we find people dying out of snake bites, people dying because the mother was trying to give birth and they could not access healthcare. There is no ambulance in the vicinity. So we need to have people on the ground who can attend to those medical emergencies, and not only in selected counties in our country, but across Kenya. And therefore, it is my hope and prayer that this project is going to help us to be able to achieve this objective of ensuring that our country is covered with equipped and professional emergency medical responders to attend to medical emergencies.
Thank you so much.
Thank you very much.
Thank you. Yeah. So just last word from you, Honorable Lugangira. Can we expect to see you championing for maybe a TOP in Tanzania?
Thank you very much. And I'm also very much interested to see what can we do in Tanzania in terms of human capital, and perhaps it can be focused around the education. And just a closing.
Oh, our Washington connection really seems to not be cooperating today. See if she will come back quickly. No, not yet. Okay, so I'm going to perhaps close this panel and just thank you both for sharing your perspectives. I've learned a lot from you both, and thank you very much for that. So our next segment, oh, there you are, Honorable Lugangira. Come in just.
Okay, I'll just very quickly say,
and then I'll close.
Thank you. I'll very quickly say that when we're talking about human capital development, I would like us to remember that we should start at the beginning of the life cycle, the education system. Find ways in which we can strengthen and capacitate our education system. Things like school nutrition, school connectivity, even basic things like access to sanitary pads for girls. A lot of rural girls miss schools every month because of being in the period, and they don't have sanitary wear. So basic things like that. And I'm very much looking forward to doing something like this in Tanzania. And the fact that we have a very committed president, Her Excellency President Samia Suluhu Hassan, who's championing human capital development, education sector, girls and women equality. I'm sure we can come up with a very good project, and hopefully next year it can also be one of the showcase programs here. Thank you very much.
Great. We look forward to that. That's what we like to hear. So please, everyone stick around, and I hope we still have Honorable Fort and Alberto, everybody, because we now have more than 100 participants connected, and our questions have started coming in. As soon as I opened the door, we started receiving questions. So I'd like to pose a few questions that have come in this first round. So one of the first questions is, in Africa, there are high mortality rates for women during childbirth, even in the 21st century. And this will probably be Alberto, so I hope he's still there. What are the solutions envisaged by the World Bank to eradicate maternal mortality? Alberto, perhaps you can help with that. Just some of the solutions for addressing maternal mortality issues.
Sure, sure. Thank you for that question. So obviously, we have been very successful in working on dealing with maternal mortality issues in many areas of the world. There are areas that are still lagging, and this is very much related to access to primary health care. It's very much related to the opportunity to have, during the pregnancy, the good and the appropriate guidance and support from medical experts in primary health facilities. Of course, in some cases, you will also need to access more complex medical services when there is a difficult pregnancy. And in these situations, there needs to be a strong network in the countries. The issue of networking, having primary care facilities in small towns and distant locations, then secondary facilities in intermediate cities, and more complex hospitals in larger cities, and having this network communicating with each other is a critical element to guarantee access to the services and also emergency services for more complex cases. In many countries, we have supported the building of this networked system. It is difficult, it is complex, it takes time, but it has proven very successful. Networking in the health system through primary up to complex hospitals is the actual way in which we can provide those services at reasonable costs. If services are provided by complex hospitals in small towns, then you want a hospital in every town, and that is extremely expensive for the health system. That is why a sophisticated and well-communicated network of primary health facilities up to complex hospital in larger cities is the way in which it's been more sustainable and more effective. Over.
Thank you so much, Alberto. Let me bring in Honorable Fort and put the second question to you, which comes in from the Philippines. And I love this idea of South-South collaboration in addressing challenges. So this person asks, how can we convince decision makers to invest in human capital when there are so many other conflicting priorities? So this is surely something you've had to contend with in Jamaica. Perhaps there's some tips you can share with our colleague from the Philippines.
I think at the end of the day, it's all about priority. It doesn't matter what the goals of the country are. If we do not have healthy, capable people to execute them, we will not achieve them. So perhaps it will require just a retake and a different mindset. And we should never underestimate what we gain from exchanging perspectives, because I do not think that any one person has the right perspective or the complete perspective on addressing a matter. But I recall years ago when I was dealing with a health portfolio as a shadow, my simple premise was that we need healthy people, we need capable people, we need competent people. And I think putting people at the center of the work and ensuring that the circumstances of their lives are better and dealing with the issues that impact them and the issues that can enable them will go a long way in doing that. And ultimately, they say it takes cash to care. So if we have a better understanding through our dialogue of how the financing is used and whether they are being targeted for the issues that will ultimately unlock the potential and make a difference, it will go a long way. That's why forum like this and the value of the parliamentary network becomes even higher for me.
Thank you so much, Honorable Fort. Let me see if we still have Honorable Lugangira, who I'd also like to hear from on that question, but I'm not sure.
Yes, I'm here.
Yes, I'd like to hear from you on this question.
Thank you. So to me, it's oftentimes when we're talking about maternal mortality, we tend to be reactive to look at, the medical related issues, but being a nutrition champion, I'm of the opinion that if we want to curb maternal mortality, which is mainly, among other reasons, caused by anemia rates in women in reproductive age, we need to go back to strengthening the nutrition of adolescent girls. And this includes basic things like dietary variety, having school vegetable gardens in schools, in households, which is something that I'm also championing in Tanzania, in the region that I'm from, and it's proving to be effective. So we may need to also change our approach in being proactive and look at the nutrition inclusion in this space. Thank you.
Thank you, Honorable Lugangira. And let me stay with you for a second, because the next question actually touches on an issue that you were raising regarding stunting and where the predominance of stunting is in your country. And the next question is asking, how can we reach the last mile in trying to make sure that we invest in the human capital of people in these difficult to reach regions? What would be some of your ideas for how institutions like ours can collaborate better to reach the last mile?
Thank you. I think the first thing is to truly analyze a country and go to the regions which host the largest number of the stunted children, which have limited visibility and limited programs in place. And then second is to do a multi-sector and multi-stakeholder approach, because nutrition is more of a social behavioral issue. So to include the nutrition specialists, government officials, religious leaders, media, political leaders, because you may be very surprised that a nutrition person can tell maybe a breastfeeding, lactating mother that make sure you breastfeed your child for 6 months. They may listen, they may not, but if a religious leader says it, or their local political leader, it has a different impact. So to take that multi-sector approach, but also to make sure that we try and engage local NGOs so that these programs can be sustainable. Because often the challenge is, once a development program ends and the donor leaves, everything dies. So to make sure there's that sustainability is to engage local organizations and make sure that even if it's an international organization who is the main implementer, to make sure they include local NGOs, CBOs in the implementation. And I think if we do that, then we can be able to truly transform the stunting issue. But we shouldn't just focus on under 5. We should also look at adolescents. And this is why the school component becomes very important. And even making sure that we get the political will. And to get the political will is whenever you can tell a politician that currently you're spending X amount of money buying folic acids to cater for reducing anemia rate.
Oh, sorry that we've lost. Yes, we seem to have lost Honorable Lugangira again. Let's see if I can give her 5 seconds. If not, I'm going to go to Nairobi. Okay, let me go to Nairobi. So we have another question that came in asking for a bit more detail on CAOP in order to maximize the lessons learned as well. And it's from Liam Byrne, MP in the UK and the chair of our parliamentary network. So he sent a question in asking if you can, maybe I'll put this to Kevin, if you can elaborate on how CAOP is financed, by whom and with what goals?
Thank you very much for that question. So the CAOP project is both financed by the World Bank through a credit, as well as there's also what we call counterpart funding. The government of Kenya as well has provided some financing, as well as provided staff across the country in the different sub-regions to support the project. And of course, the financing model, even as we even as we've been implementing, is going to be developed more, particularly because the government of Kenya is looking at having a second follow-up project, and will also bring in subnational governments and seeing how this can be co-financed including other development partners that are in the same space, providing similar programs just to see how this can be consolidated to provide support to the youth employment space. So I don't know whether that has answered this question, but happy to provide more details.
And perhaps you can just share with us a little bit of context of how long has it been running? How long did it take for us to start realizing some of these results? I think some of that illustration could also be helpful.
So the project has been running for, this is the 6th year. I have to say that normally when a project starts, there's a slow start. However, because the different interventions were short interventions, I think that's really key, to have short, impactful interventions and to find the right interventions so that they have a bigger impact. So for example, with the skills training, this took a month of social-emotional skills training, as well as 5 months technical training. And we've seen a success in the youth still finding an opportunity in the employment space, as well as having the capacity to start their own business for those who were able to get grants. So in terms of for a project like this, for us, we have been tracing the youth since year 2 of implementation. And we've seen all the cycles. This is the 8th cycle that we have. We've seen success 3 months after training, 6 months after training. We are seeing success results in terms of employment.
Thank you. Thank you so much. And I think what I'll do at this point is pause on the questions which we continue to receive so that we can move on to our next panel, which I'd like to get to and bring our colleagues who are waiting into this conversation. So our final panel discussion for the day is on partnering for human capital outcomes. What are the strategic benefits of partnerships? So allow me to welcome our 3 panelists who will be joining us. From Action Results, which is an organization that works to influence political decisions that will bring an end to poverty. We have Senior Advisor Sochi Sanchez. Good to see you again and welcome. From the International Monetary Fund, the IMF, we have Clara Mira, who is Deputy Division Chief in the Africa Department. She also leads the IMF's African Department Inequality Network. Welcome, Clara. And finally, another representative from Parliament, this time from Cameroon. We have Honorable MP Njume Peter Ambang, who is also a member of the International Parliamentary Network for Education. Welcome, sir.
Thank you very much, Edith. It's my pleasure.
So I understand you will be speaking in French?
No, I was speaking in English.
Oh, you're speaking English. Okay, great. Okay. I'd like to start by posing you all the same question. And so if you're ready, I'll go right ahead. What are some successful parliamentary actions and investments in pursuit of improved human capital outcomes from your organization's perspective? And maybe, Honorable Ambang, I'll go to you first. And now just repeat the question. What are some successful parliamentary actions and investments in pursuit of improved human capital outcomes from your perspective?
Yeah, thank you very much, Edith. I want to thank the World Bank and the IMF for having organized this kind of forum. I think it gives us the opportunity to speak and to be able to understand from each other how far we are moving. We at this level, especially are concerning the objectives of the International Parliamentary Network on Education. We have been working so much on quality education. And we have been partnering with civil society organizations, like here in Cameroon, for example. We are working with the Cameroon Civil Society Organization for Education for All. And in this very large organization, we have approximately 70 civil society organizations in it. And we have been trying to meet with the government. Our concern, however, has been on trying to talk much about teacher training, because we believe that when it comes to human capital, education is primordial. It is only through quality education that we'll be able to build up our nations and build communities the way it's supposed to be. And so we have been working with the government, and so far so good. The government is trying to work very hard. Recently, the Minister of Basic Education took a commitment in New York during the Summit on Transformation of Education, took a commitment, and we are looking forward to meet him, to discuss with him, and to see how far they will be able to implement the commitment that the government has taken. Also, you know, because of the crisis in some regions here in Cameroon, education has been highly affected, especially concerning basic education, where we have thousands of children who have not been able to go to school because of the crisis. And so we have been struggling to see how we can meet with civil society organizations and the government to do something, especially trying to work on digital education. And here the Minister of Secondary Education has been doing that, but it's not still meeting up with our desires, or you know, trying to see what we think ought to have been done. So there is still much to be done, because it is not up to what we were expecting, because the crisis is still ongoing, and there are many children in those areas who are not going to school. So far, we have asked the government to see how they can take those children in the villages where there are no schools and bring them to some particular centers so that they'll be able to attain education. So that is what we have been doing this far. And I think it is yielding fruits. Many children now are now going to school, and but then the quality is not there because the teachers are not there, and the training that some of the teachers have received is grossly inadequate because it doesn't give them the skills for 21st century learners. Thank you very much.
Thank you so much, Honorable Ambang. Very important points that, let me bring Ms. Sanchez in, please, so that you can pick up on that. Thanks. It looks like you're muted, Sochi.
Oh, apologies. Can you hear me now?
Yes.
Great. Yeah, sure. Hi, everyone. Thanks for having me today. My name is Sochi Sanchez, and I'm a senior advisor at Action. We're a global health advocacy partnership of 15 locally rooted independent organizations spanning 5 continents, supported by a Washington, D.C. based secretariat. We as civil society partners and advocates around the world work with governments, parliamentarians, the bank, and a number of other multilaterals to increase investments in human capital and kind of build that political support for global health to create more equitable society. So I think I'm encouraged to hear the number of projects and examples, because our partners are leaders locally in their communities, and they work collaboratively at the regional and global level across North and South to try to have that impact at various levels. Our work is guided by 3 main pillars, which I think really deliver on increased human capital. And so I think, you know, focusing on a healthy start, which looks at areas like nutrition and routine immunization, areas like ending the epidemics, which focuses on eliminating deadly preventable diseases like TB, for example. And equitable and sustainable health systems, looking at health financing, health systems that can prioritize UHC, universal health coverage, and deliver equitably on primary health care. So I think, as many of you have mentioned, COVID has cut many of the gains that we've made in the last few decades and exacerbated many of the inequities that we've been experiencing. So I'm encouraged to see the number of areas that we're working with. And, you know, we've been working with the World Bank and parliamentarians at the country level to find smart ways to increase domestic resources for health, to ensure that that money is coming from financing mechanisms. Multilaterals are working in tandem to invest in sustainable health systems that can be resilient to things like COVID-19, and so that we can be prepared to respond to the next threat or epidemic. As civil society, I think it's important for us to have a seat at the table, right? Within that preparedness and response, making sure that we are consistently targeting the most vulnerable and hardest to reach. Because without them, we can't attain these high results. We can't reach our targets, and we'll continue to leave people behind. And that's not something that we can afford to do as a global community. So I feel fortunate to have supported our partners over the years to strengthen programming and investments in nutrition, helping organize meetings of parliamentarians of investing in the early years and seeing how we can best address stunting, playing key roles in countries to drive, for example, the global financing mechanism for reproductive, maternal, newborn child health, engaging at the country level with multi-stakeholder platforms, and ensuring that CSOs and community are part of the design of investment cases. And I think for us, IDA 20 in particular, is going to play a very key role in helping delivering these projects. So as we look towards human capital, I think Action is really excited about how we can continue to partner and do some of this work to make sure that we're increasing the priority of human capital investments, elevating health, early childhood development, nutrition, and other interventions that can address, especially the urgency right now going on with malnutrition and the food crisis. I know others, including Honorable Neva, mentioned that. So like I said, I think exciting to hear about how others see the value add of civil society and having us at the table and how we can continue to work together to support this work.
Thank you so much, Ms. Sanchez, and absolutely, I think your role is extremely important here. So thank you for elaborating a little bit more on that. Let me go to Ms. Mira with the same question. Please come in.
Sure, thank you. Thank you so much. Thank you so much for inviting us to this very important event. I've been very excited and enjoying a lot all the presentations and all the discussion that we've been having, which is very timely. Also the points for more dialogue between IMF and MPs and everybody and the role of the parliamentary network. So points very well taken. And just wanted to make a few points, even if many have already been made, on why we think that strengthening human capital is an absolute priority for the region. And it's an absolute priority, and we know, to protect the most vulnerable and to ensure a more sustainable, inclusive growth, economic and social stability as well. So as being the IMF, we've done research, and many studies, of course, find the very important role that investment in education and health have for inclusive growth. And I think a point that is very interesting that it's emerging is how investing in human capital and investing in infrastructure are complementary. So there is no trade-off. If we invest in both, if countries invest in both, the results in terms of growth, poverty, and inequality reduction are more important. So it's I think, an important message. And the other point is obviously the urgency that we've been alluding to. So if the human capital needs of the region were already acute before COVID, now they have become even more relevant. The gains in global poverty reduction, the food security, etc., all these improvements are unfortunately being reversed by the shocks that we've been experiencing. So the school closures in Africa have been more prolonged than in other regions. And this is likely to exacerbate and, of course, have affected more the most vulnerable households and girls. So this is likely to exacerbate inequality within countries, across countries, and also across continents, pretty much. So it's very important to respond and to invest in health, in education, and in social protection. There are trends like climate change, digitalization, which are also widening some of these income gaps. So they really need to also be taken into account. I guess another important point is that we've seen the crisis has allowed us to see that countries that had strong social protection systems were able to cushion the impact of the shock in their populations better than those that did not have it. So we already knew that social protection were very good tools to mitigate the impact of crisis in the most vulnerable, but the food price shock, the fuel price shock, fertilizers, post-COVID really show that indeed the situation, if a country has a good social safety net, it can be quickly scaled up, and these measures are cost effective. So really, the cost when we compare the cost and the value added that they bring, they are really a good idea and a good investment to be made. When we also look at the future, looking at demographic trends, etc., we see that at least half of the new entrants in the global labor force over the next decade are going to come from the region, from Sub-Saharan Africa. So really, the education, the health of this global labor force, it's very important for the global economy, for the region, and also for the international community. So really, the key message for us is that strengthening human capital is indeed an absolute priority, given the current situation. It was, and it's becoming even more and more urgent. So maybe I could say a few words on how the IMF can help, or what the IMF, okay, thank you, Edith. So basically, within our functions, what we do at the IMF is three things, basically: provide advice, provide financing, and provide capacity development. So within these three areas, we are trying to support the efforts of the countries to spend more and spend better in human capital. In terms of advice, we are doing much more analysis, much more analytical work in inclusive growth, inequality, human capital investment. We recently organized a policy dialogue on inequality, and there are interesting presentations there that we can check. We also have more support to countries so that they can spend fiscal resources, including by mobilizing revenues better and spend better and more efficiently. So focusing also on key health and education. We have a new gender strategy. So we are integrating the gender dimension into everything we do, because we do recognize that reducing gender disparities really go hand in hand with higher economic growth and economic stability and lower inequality. And when the IMF has a program, there are always social spending floors, which means that social spending has to be protected. So it cannot be lower than the agreed floor. And finally, maybe a very important point is that we have increased over the last few years the financing amounts available for countries, so that when they've been hit by all these shocks, they still have space to spend in human capital and in social protection and in health and education. So there has been a very large amount of funds going to the region for emergency response to COVID, debt relief, and we've had the SDR allocation, so $650 billion that were issued by the IMF last year, of which 33 billion have gone to Africa. So these have allowed the continent to have sufficient resources to continue to spend on human capital. We have two new funds that we are just launching: the Resilience and Sustainability Facility, which will help countries look at longer term needs, climate change, pandemics, see how they can use these resources to strengthen resilience, and also a new food shock window to respond to the current crisis triggered by the elevated food price shocks following the war in Ukraine and Russia's invasion of Ukraine. So these are some of the recent actions that we've done. And the whole thinking of this is that it is important to ensure that the crisis does not reverse the gains that the continent had achieved in terms of poverty alleviation over the last few years. And the point that I think it's important is that this is a shared responsibility. So it's a responsibility of everybody, of the international community as well. So international solidarity to respond to these shocks, to provide resources, etc., is really necessary given the magnitude of the shocks and the importance that this can have going forward. So let me stop here. Thank you so much.
Thank you so much, Clara, and especially on your last point. I think that's so important, and that's why events like this are so great, as an indication of the importance of that collaboration with representatives here today from civil society, of course, the bank and government, etc. So I think very important point that collaboration towards the same and one goal is really key. I'm going to go to you, Honorable Lambang, next, because I'd like to hear from your perspective, from the International Parliamentary Network for Education. Can you just share with us how you think the network can work alongside the World Bank to prioritize people and build a more sustainable, inclusive, and resilient future for families and communities, especially in this spirit of collaboration? Could you just share some examples with us? Thank you.
Thank you very much, Edith. I think it is very obvious. You know, this parliamentary network, just like my colleague and sister, Honorable Lugangira said from Tanzania, unfortunately, the World Bank and the IMF are only working with the governments. We represent the people. We know what is happening down there. We know what has to be done, but we are not consulted. And so if the World Bank actually wants to solve some of these problems, it is to work in collaboration with the International Parliamentary Network for Education. Because we also need capacity building. I have been able to meet with UNESCO here in the country because I'm also the executive president of the Parliamentary Network for the implementation of Sustainable Development Goals here in Cameroon. So they can come and empower the parliamentarians on how, through education, we'll be able to achieve the SDGs. But this moment is 1 year now, I've not been able to get them. And the parliamentarians have been asking me. So these are the areas I think the World Bank can collaborate with these networks, or like our network, in order to build capacity and help us to see how we can carry on with our work. We are a lobbying force. We are a force that is advocating, but we need capacity building. We also need to be given that information that, okay, we are coming to Cameroon, for example, we want to see how we can help this country build quality human capital, not just human capital, but quality human capital. And so we are going to work with this network and the government in order to enable us to attain maybe the objectives that you have in mind. Because if you only work with the government, they don't call us, they don't involve us, they work on their own, and we don't even know what is happening. You put money in the government, we don't know what is happening. And so it's difficult also for us to play our oversight roles, which are to pose questions to government ministers on how they used what came from the World Bank and IMF. We cannot ask questions from the air. We must have information. So I think that is one of the ways I think we can function. We are also trying to ask that if the World Bank really wants to help this region, we thank you very much for what you have been doing at the IMF in terms of maybe recruiting teachers. You have to continue with it because actually we lack teachers in these countries. But also, please let us work on seeing how we can transform the curriculum. We have to improve on the curriculum. The curriculum is outdated. The curriculum doesn't provide or train learners for 21st century skills. This is where we are. And then you see that the whole region is backward because it hasn't got quality teachers. And if we don't have quality teachers, we will never have quality learners. And therefore, we are not going to have quality manpower to transform the communities. So I think that collaboration is very, very important. Involve us whenever you want to meet our governments. We have a lot to contribute. And so it will enable us to also monitor and also work with government to see how the objectives can be attained. Thank you very much.
Thank you so much, Honorable Lambanga. And I can imagine you've just created a new hashtag that will likely go viral, called hashtag quality teachers for quality learners. I can see that in big headings. Let me turn to you, Ms. Sanchez, and pose the same question to you as an organization that advocates to end poverty. Can you speak a little bit about collaboration with us and with others?
Yeah, I think collaboration is obviously kind of like at the root of the work that we do. And I think some of the ways that we try to make sure that we are delivering and actually moving towards some of these human capital goals is to make sure that we are approaching and taking an approach that's community and country driven. I think there's an aspiration for the work to be country driven. And I think when I sit in rooms with folks from the government and the World Bank, the word country driven is very much brought up. But there's still a ways to go to ensure that that is implemented and actually plays out itself in practice. I would also say that I think just echoing what Honorable Parliamentarian was mentioning about, we often hear from parliamentarians that we work with that they want to be more engaged. They want to be more in the loop, but finding more tangible ways to facilitate that engagement and creating those opportunities to not only bring their value add when it comes to things like budget oversight, accountability, but the voice of the community and making sure that it's not just, you know, having a seat at the table, but a voice and a vote at the table, I think is important. And I wouldn't be doing my job if I didn't remind us all of the importance of bringing civil society to the table as well at all levels. You know, we've seen in practice that participation of civil society, and again, bringing up the example, I think for us on the global financing facility in a number of countries where that's improved the impact, the buy-in, the mechanism, the investment case, and the projects themselves. And there should really be a deep-seated commitment to engage with civil society more meaningfully, not just, again, like I said, to check off a box, but to leverage those voices and learn from experiences. And I think without that, it's going to be hard to achieve these goals. And, you know, I know, you know, we just talked about the SDGs. We're past by half the mark. We know what the results are that we need to achieve and some of the pathways to get there. And I think hopefully, you know, collaborating within these groups, you know, within these parliamentarian networks and making sure that we are working at all levels, right? And I think in particular with the bank, and something that I've appreciated for the parliamentarian network in particular is that there's the work at the community, at the country level. We talk regionally and share examples, and then we also come together at the global level, similar like this forum. And so I think for us, finding ways in which we collaborate to make sure that we have the financing, we have the resources, and we have the collaboration needed to achieve those results for now and for generations to come is going to be how we achieve some of these human capital goals.
Thank you so much. Very important points, Sochi, and we've worked together for a long time to make sure that seat at the table is consistently there and across all levels for civil society. So let me go back to Ms. Mira and bring you in with a different question. What do you see as the biggest roadblock to improving human capital, and how can we overcome it together? And unfortunately, it's just one roadblock you have to highlight now. Extremely difficult, but over to you.
I know that's tricky to think about only one, but given what we do, I think the big one that I'm going to highlight also, given the very difficult economic situation, is the resource availability, pretty much. So the lack of fiscal space, the lack of financing for governments to expand as they would want. Expenditure in health and education and social protection. So this has always been a problem. So fiscal space resources have always been limited. But what we see these days is that public finances have deteriorated even further because of the pandemic, then the food and fuel price shock and its impact on the budgets of countries. So the countries now have to juggle many different competing demands. Inflation is high, fiscal buffers have to be rebuilt. So the situation has become quite complex in terms of availability of resources to ensure that investments in human capital can continue and can even be scaled up. So in terms of how to overcome it, I think in our way, this is a bit what I was mentioning earlier, two things. So one thing is countries themselves, and the other thing is international solidarity and multilateral cooperation. And on our side, we are trying to support both of these tasks. So for countries themselves, so that they can really look at their processes, the budget, how they are collecting revenue. Is it efficient? Is it from a distributional point of view, is it rational? Is it reasonable? And then on the expenditures, are there ways to spend better, to be more targeted, to be more efficient? And we are trying to provide technical support, so assistance in that front, also financing when needed, but mostly technical support. And the role of the international solidarity, I think it's very important. It has always been, but now even more than ever, given the development that we've seen, given that we've also seen some downward trend in support, development support and budget support in particular for the region, which is a bit puzzling. So really a role for everybody to provide more financing and to work together. And I think these initiatives are useful. So on our side, as we were saying, both the SDR allocation and these new facilities that we are putting together, we think can contribute so that the problem of the very narrow fiscal space can be somehow mitigated. And we make sure that the recent gains in poverty alleviation are really not lost, and we avoid disruptions to investment in human capital. Thank you.
Thank you very much, Clara. I am though wondering, just because this question came up before about reaching the last mile, I'm wondering what you think about how human capital can also support efforts to reach these communities that are on the margins and sometimes very hard to reach.
I think social protection really needs to be scaled up. This is a topic that sometimes in the past maybe hasn't been addressed so thoroughly, but the value of social protection to make sure that the most vulnerable have access to a minimum so that they are protected against these shocks, I think is very important. And I really appreciate there is a very important effort in the region going on scaling up infrastructure, scaling up all sorts of investments, and this is going to help these communities, and this is critical for growth, which is what at the end of the day is really going to create opportunities for everybody, but cushioning the impact on the most vulnerable and giving them the minimum that it's needed so that they can have some tools to start a business or to go to school, the school feeding programs, etc. All of these I think are really necessary and would help isolated communities like the one we discussed earlier.
Thank you so much, Clara. And thank you to all my panelists for your contributions to these discussions. It's actually been quite illuminating. And I know that we could continue and take this even further. I also want to remind our audience to continue this conversation online using our hashtags, invest in people, and putting people first, and even the new hashtag that Honorable Ambank has no doubt inspired, quality teachers for quality learners. I will reiterate that the World Bank is committed to building, protecting, and preserving human capital outcomes. We cannot and must not lose sight of the medium to long-term development challenges and shocks, and we must address the interrelated crises of health and climate and conflict to ensure we safeguard human capital investments that improve development outcomes. This is fundamental. So with that, once again, thank you to all of you. Honorable Ambang, I hope Honorable Lugangira can still hear, and I'll say goodbye to her as well. And Honorable Ford, thank you so much for joining us. And our colleagues in Nairobi, Kevin and Peter, thank you, Sochi, and thank you, Clara. Thank you all. So with that, I'm going to invite our World Bank Regional Vice Presidents for the Africa region to deliver their call to action for the East and Southern Africa region. And of course, my boss, well, they're both my bosses. I think they're in the room now, both of my bosses, but the very first person I'll introduce is Dr. Victoria Kwakwa, who oversees the East and Southern Africa region. Welcome, Victoria. And to my second boss for the West and Central Africa region is Usman Diagana. Welcome, Usman. And I'd like to now turn to you to deliver your call to action. Thank you. Oh, I think you are muted in the room.
It's good.
Yes, I can hear you now.
Okay, good. I was just, yeah, good morning, Edith. Good morning, good afternoon, good evening, wherever you are. It's a pleasure to join this global parliamentarian forum for this year with the express focus on human capital and particularly human capital in Africa. And thank you all for joining. So I think it's really in order for Usman and I to join to really be part of this call to action for all of us to really join forces to recover the losses from the COVID pandemic and to make even further progress on human capital in Africa. As we know, the COVID-19 pandemic and overlapping crises, including droughts, food shortages, the Ukraine-Russia conflict, and regional armed conflicts has been a wake-up call that we have to do better in protecting human capital, particularly for marginalized and vulnerable groups such as women, girls, and people with disabilities. We must build resilience across all facets of the economy, strengthening human capital through better services for health, for education, social protection, housing, water, and so on. Social protection systems will need to be adaptive and inclusive, supporting the most vulnerable households while preventing non-poor households from falling into poverty. Following a historic replenishment of $93 billion, the IDA 20 commitments are wide, pressing, and varied as they focus on human capital, on climate change, on COVID-19, on conflict, inflation, rising debt, food insecurity, gender, jobs, and more. With IDA 20, we're putting people first. We're prioritizing human capital investments in people, their health, their education, which feeds into a country's overall economic health and resilience. IDA 20 is inclusive and intentional about leaving no one behind. Women, children, people living in areas affected by fragility and conflict. IDA 20 has a robust focus on crisis preparedness, with an emphasis on strengthening pandemic preparedness and food system resilience to help countries weather emergencies. This means that through this package, IDA will deepen support to countries and their systems to better prepare for and respond to future crises, including pandemics, financial shocks, and natural disasters, and also invest in stronger and more resilient food systems by supporting agriculture and helping families cushion the effects of higher food prices. In the Eastern and Southern Africa region, for example, more than 135 million people were food insecure or had insufficient food consumption in 2021. In the region, we have seen an episode of severe food insecurity crisis taking place every 2.5 years in the 2000s, compared to every 10 years previously. Conflict, climate change, and economic shocks have converged to prevent food from reaching some communities, to depress yields and make staple items more expensive. In Somalia, for example, a combination of instability, conflict, and climate change, induced extreme weather conditions has led to repeated episodes of food insecurity. Currently, the World Bank supports Vaxnanamo, the Somalian government-led safety net program that aims to support the poorest and most vulnerable households via direct cash transfers. During the first 2 years of implementation, more than 1 million people received nutrition-linked unconditional cash transfers to meet basic consumption needs. Women accounted for 100% of direct recipients. Also, nearly 600,000 individuals received livelihood protection through monthly emergency cash transfers in response to the locust crisis. This is a prime example of how we have, through IDA, been able to deepen our support to countries in crisis and protect the most vulnerable. Since April of this year, the World Bank has committed about $4 billion in new financing to help countries in the region boost short and long-term food security. This includes supporting social protection programs that make a real difference and helping countries make much needed investments in sustainable food systems to increase food producers' resilience and productivity and facilitate food trade. For people in their daily lives, this makes a big difference. With cash in hand, households avoid making decisions that hurt them in the long run. They sustain food intake, avoid selling productive assets such as livestock, and keep children in school. IDA 20's commitment to tackling climate change greatly mitigates its impact on poorest people. All of us, the World Bank and IDA, stand ready to partner with countries as they rebuild their communities, their economies, and make better investments in human capital. But we can only move the needle with strong leadership from you, the parliamentarians. You as parliamentarians are indispensable as you are elected by the people and therefore speak for the people who you represent. A business as usual approach will not deliver sustainable and inclusive growth. Rather, a whole of government approach that sustains efforts across political cycles, coordinates across government, and designs policies and programs that use and expand the evidence base is the most effective in accelerating human capital for the long term. Your voices and actions are powerful, and you can count on the World Bank to be a strong partner on these multiple fronts. Thank you very much.
Thank you, Victoria, especially for that reminder that we cannot continue with business as usual, a very strong call to action. Usman, over to you, please.
Thank you very much, Edith, and thank you very much, Victoria. Very pleased to join you in your office and to engage with parliamentarians on a subject of critical importance, investing in people, transforming communities. I hope that next time we'll have the opportunity to have this engagement with you on the ground, because as parliamentarians, you are men and women of action and action on the ground. So this is a very special time for all of us, and certainly for our countries and for the population. And as parliamentarians, you are key actors in shaping the success of human capital intervention through policies, reform, and oversight. Your pragmatism is to translate policies into action, as I just mentioned, through measures adapted to your country context, your region, and your community. I mentioned this, you are in very trying times. As crises multiply and the devastating conflict in Ukraine drags on, global effects are being felt hard across Africa, and this is a threatening hard-won development gain over the last decade. And if you look at this from human development side, and we take the three components of human development on which we work at the World Bank, education, health, social protection, we can see that the challenges are in number of areas, but mainly in four. The first is equal access. Second is quality. Third is governance and accountability, and the last is financing. So, regarding education, for instance, as we speak, millions of children in Sub-Saharan Africa still remain out of school or cannot read and comprehend a simple text by the time they reach the age of 11. Our countries are facing learning crises that have been exacerbated by COVID-19 pandemic. So to help countries tackle these challenges, as institution and in Africa West and Central, we have embarked on a series of consultations over the past year to reach out to technical experts, to decision makers, to stakeholders, including parents in the field, and including also parliamentarians, and talking also to teachers and youth organizations to produce a new regional education strategy for Western and Central Africa. We were very pleased when this report was finalized to convene a meeting in Accra, led by the government of Ghana with the participation of all the Minister of Finance, Minister of Education, and representative also of the Parliament, to give us their feedback on this report, but also to advise us on how we can move swiftly on the implementation, which is critical for changing or shifting the paradigm regarding education. This education strategy, therefore, offers a roadmap of intervention to tackle the learning crisis in basic education, keep girls and boys in school, and making sure that they can go to school ready to learn, and also, obviously, to provide second chances for illiterate young adults who dropped out or never attended school. The strategy relies on available evidence and operational experience to set country-specific priority intervention that represent a significant change from business as usual. The same can be said, obviously, for health sector. And today, in fact, we are launching in partnership with some key stakeholders another study regarding how we can help countries strengthen their health system and health emergency preparedness in a more systemic way, taking into consideration lessons learned from the ongoing COVID-19 impact on our health system and the population of the different countries that we do serve. Our IDA 20 commitment includes a strong focus on preparedness and operationalizing the One Health approach, which enhances understanding among sectors, identify risk mitigation options, and provide a more complete picture of how human health is linked to other animal species and the environment. World Bank investment in health sector have grown over the last several years, providing a foundation for advancing the health system strengthening and preparedness agenda. We have built a strong track record of programming on preparedness, notably through the regional disease surveillance system enhancement, REDICE project, which was launched in the aftermath of the 2014 Ebola outbreak that hit countries like Guinea, Liberia, and Sierra Leone, and aim to strengthen health system and support effective disease surveillance. But to enact meaningful change, we must work together. in helping countries to be better prepared for the next crisis. And parliamentarians have a critical role to play in this. Finally, on social protection, we are focusing on programs that strengthen the ability of the poorest and vulnerable to recover quickly and more effectively from shocks by enhancing safety net programs that make meaningful impact in families and communities. In addition to the excellent example that Victoria has shared with us regarding Somalia project, also would like to share with you the Wadata Talaka Safety Net project in Niger. This operation is about how can help communities and fragile and vulnerable groups to improving the capacity of the safety net system to respond to shock. And this operation has fostered more productive livelihood and improved resilience of poor households by providing unconditional cash transfer to more than 400,000 families during the pandemic. What has emerged from our engagement with human development partners and practitioners is that it's very important for reform policies that influence human capital to be translated to action, or else they are just good practice that make no change in people's life and livelihood. So putting people first is key, and it allowed to actually to thrive means implementing innovative multi-sectoral intervention, so no one is left behind. This is why you as legislators and policy makers are vital in this process. Our institution stands ready to support countries that are committed to investing in people and improving human capital outcomes. We'll be at your side every step of the way to provide support, bringing resources and expertise, and sharing knowledge and technical assistance. Thank you so very much.
And thank you very much, Usman, and to both of you really for those inspiring words. I think your presence here and doing so together really conveys the bank's commitment to the human capital agenda. We've had about 100 parliamentarians on this session this morning who've stayed all the way through, and I'm sure listening to you and to everything that they've heard today, they're going to be empowered to continue to implement innovative and sustainable solutions to the challenges that destabilize lives and livelihoods, economies, and of course, social systems. Once again, it cannot be business as usual. Some parting words for you there. So let's all continue to leverage platforms such as this. I think this parliamentary network platform is extremely important for engaging, for finding solutions, sharing ideas, and promoting the important investments that are being made in human capital. So thank you to all of you for your participation today. The links to the stories, the result stories, more of the result stories, you saw one today from Kenya, but the links to all our result stories that we've talked about today will be on our events page, and we will also email them out to all of our participants. So thank you once again, and have a great day. Goodbye.
Thank you, goodbye, thank you.
Good morning, good afternoon, good evening, good night to everyone.
Good night. Thank you, Honorable Fort.